pain is a very common health challenge, especially low back pain. It is estimated that 80% of adult population will have back pain at one point or the other in their lifetime. Many of these conditions will resolve, but over 20% of them will progress to chronic joint pain. But the question is, what brings up this back pain? What are the causes? So today, I bring to you the back pain culprits as well as their solutions. My name is Dr. May, and I encourage you to join us as we take a ride in discussing this health condition. So what are the culprits for low back pain? One could be your job. If you are doing a job that puts stress at your low back, especially jobs that involve carrying loads, pulling on things, that can twist your low back. If your job also involves sitting all day, you have to be careful because you are highly predisposed to low back pain, especially when your weight is increasing and when the seat is not a very comfortable seat. Okay? If you have the habit of slinging bag over your shoulder, especially heavy bags, definitely you have to walk erect. But that is to the expense of a side of your joint. To avoid the weight pulling you to one side, the other part of your low back or your back muscles will have to tighten and strengthen to carry you and keep you in a erect position. So while you carry that bag along, one side of your low back is suffering, and that can predispose one to chronic low back pain. Okay? Going to the gym, wonderful thing to do. Even some of you, your doctor have asked you to go to gym so that you can lose weight. But be careful of the kind of exercises you do in the gym, because some of the exercises might strain your joints, especially your low back. The experience is that some people go to the gym and come back worse than they went. So let it be exercises prescribed to you by your doctor so that you know your limit and what to keep yourself to. Okay, sitting all day and slouching. When you sit, make sure that your low back is resting at the backrest of your seat. If your seat is in such a way that your low back is not touching the backrest, you might put a throw pillow to cushion your low back. Because when we sit, the low back, especially the fifth and the fourth lumbar vertebrae, carry the whole weight of the upper back. So if your low back is not being supported, that area will be put under a very great strain, and that can predispose one to chronic low back pain. A medical condition in which the disc of the joint has herniated. When the outer part of the disc cracks, the inner part, which is a soft jelly called the nucleus pulposus, will herniate through that crack, and it will begin to irritate the spinal nerves, the root of the spinal nerves. And that will cause low back pain, and the pain that radiates down to the buttock and the back of the thigh. Okay? Sleep or no sleep. Poor sleep has been found to aggravate joint pain. Some have claimed that yes, it's the joint pain that prevents one from sleeping. But the basic thing, the underlying thing there is that there's a vicious cycle. If you do not sleep well, pain gets worse. When pain gets worse, sleep disappears. So something has to be done to break that chain. Okay? When you are lifting an object, be careful that you don't lift the object like this gentleman. Because as you're lifting this object like this, you're putting the whole weight is acting at your low back. And that putting a whole lot of strain at the low back. It can snap. And that can be the beginning of the journey to chronic low back pain. If you have done surgery, especially surgery at your low back, when the wound is healing, it can form scar. And that scar can trap the nerves. When the nerves are trapped, it is a huge source of chronic joint pain or chronic pain. So if it's happening at the back, can be a common source or cause of chronic low back pain. Delivery these days can be painless through the process of epidural analgesia. But it has been found out that 1.5% of women who go through this procedure might eventually come down with chronic low back pain. Okay? It's good, but it can predispose one to chronic low back pain. How fat is your wallet? Everybody prays for fat wallet, but not your low back. Because when you sit on a fat wallet, it tilts your pelvis and your low back, causing strain at your low back. So if you have to have a fat wallet, which is a blessing, please pull it up a bit so that you will not be sitting on it. Okay? In pregnancy, especially at the later part of pregnancy, the third trimester, when the baby is descending down, the head of the baby or the lower part of the baby can press on the sciatic nerve. That can cause terrible low back pain and even pain radiating down the leg. But good thing, when delivery is done, this symptom usually disappears. But some women still carry this symptom on, and it leads to chronic low back pain. There's the developmental condition that is known as fallen arch, or flat foot. This is the normal foot that is arched, but this one is not arched. How you know? If you march on water and step on the floor, this is how your footprint will look like. But if you have flat foot, your footprint will look like this. So people like this usually develop low back pain when they stand up to walk or when they walk for some distance. If you're having this condition, it is encouraged that you see a foot specialist that will guide you or give you what to wear. Chronic smokers, puffing that smoke, you are taking a whole lot of nicotine into your system. What nicotine does is that it constricts the blood vessel, which will reduce blood circulation, especially to your joint, including the lower back. So that can predispose one to low back pain. Okay, so these are the culprits and many more that I cannot mention today. But the question is there anything one can do? Yes, there are things you can do even at home, what I consider as home remedy. When you sleep, please assume a very good sleeping posture. And these are the best sleeping postures. If you are going to lie by your side, please make sure that your spine is straight. You can achieve that by sleeping with a good pillow and putting a cushion like a pillow between your legs. That keeps your spine straight. If you are going to lie on your back, which is very good in strengthening the spine, okay, you can also put the pillow under your knees, so that the leg will not be stretching your back, especially for those who have low back pain already. Your sitting position should be like this. At home, at office, wherever you are, walking, keep your spine erect while you sit. Okay? So sitting position is very important. You can also, at the end of the day or in the morning, twice a day if you can, use heat pad over your low back. Let it not be hot because it can damage your skin. Warm pack over your low back. That helps to warm up the muscles and your low back, encouraging blood flow, and it reduces pain. Okay? TENS is a machine or a procedure through which you pass electrical stimulation to your muscles to vibrate them. One can obtain these machines. They are not really expensive. Under 15,000, 10,000, you can get one, and attach the electrodes and switch it on to the mode that vibrates your muscles without giving you so much discomfort. It also helps with tuning the nerves and helps with blood circulation around that area. These things are good to reduce or to minimize low joint pain. Please take a walk. Some of us give in because of the pain. You sit all the time. That increases your weight. That stiffens your muscle. As much as you can allow you, take a walk every day. That helps to strengthen your muscle. That helps in blood circulation. That helps to reduce joint pain, including low back pain. You can also do yoga. Yoga exercises that can strengthen your muscles, stretch exercises, apart from the walk and minimal aerobic exercises. You can do these ones. It will help to strengthen your muscle, but before you do any of these exercises, please consult your doctor so that you do not do wrong things. You have done all this and pain still persists. It's time to see a professional. And there are many professionals you can see. You can see chiropractors who do what is called spine manipulation. They believe with this exercise they can realign the bones of your back, and that will reduce the pain. Do we encourage this? Not really, but good professionals know how to handle this kind of situation, and it can help with your low back. Please go for that massage. It's very good, gentle massage. It's very good to loosen the muscle and encourage circulation. Okay? Acupuncture, how far does acupuncture help? It helps a lot. It helps a lot, especially when it is well done by the professionals. Okay? So acupuncture is good for low back, and not only low back, for other joints as well, if you can meet a good professional. This is very common, and all of us know this, taking medications, and that's what is commonly given. That's professionals majorly their number one treatment option. To give you medications, but to do not advocate or do not encourage you to be on these medications, whether they are supplements or painkillers, for a long time. If they do not work, just as I said, if your symptoms no better, do a higher thing. If you have been taking the medications yourself, you are not seeing a doctor, go and see a doctor, and a doctor that knows about joint issues, especially low back issues. Okay? So when you meet such doctors, some might give you a epidural injection, which is very good. Epidural injection, in which steroid is injected into the epidural space, is a potent painkiller. It can help you to be pain-free from 0 to 100%, meaning that it might work to some extent. It might help you to be pain-free for even more than 6 months to 1 year. Okay? So it is a procedure that is done, and it's very good. Some also do nerve block. Nerve block is where the particular nerve that's identified that is carrying the pain can be blocked to give you relief for some time. Okay? All right. So after this, when things don't work, surgery used to be the option. It's still an option now. You go for surgery for decompression, for discectomy, to cut off the disc that is involved. Maybe use plate and screw to, to fuse the vertebrae, the area that is involved. So surgical procedure can be done, but these days and age, a new chip in the block. Okay? Instead of going for surgery, it has been realized that you don't need to cut off anything. You don't need to destroy anything. Surgery is more like cutting off and destroying, but it can heal, it can repair. So there's a treatment that's known as regenerative therapy, which can heal and repair the damaged ligaments and cartilages and restore the low back to its functional status. Okay? So there are many of them: dextrose prolotherapy, human stem cell injection, PRP, prolozone, cold laser. These are recently discovered treatment options that you don't need to go invasively for surgery, but through needle injections, these things can be introduced into your low back, and they can restore the joint or the low back to its normal and functional status. Thank you for watching. This is what we have for you today. We invite you to join us again in our next episode, and encourage you to share these lectures, because information is key. Many people don't have the right information, and that's why they are suffering in pain. So you have gotten the information. The question is, what do you do with it? If you act on it, and act on it on time, success is usually guaranteed. See you again in our next episode. Thank you very much for watching.